3 years ago in January, the Branstad Reynolds administration announces plans to privatize Iowa's Medicaid system by hiring it was out-of-state, for-profit managed care companies. The promise then was that by privatizing Medicaid, we were going to improve health outcomes, we were going to expand services in our local communities, and we were going to save money. Yesterday, of all days, April 1st, was the second anniversary that the Medicaid system was privatized and went live. So, how is it working? If you review this report, this is what you're going to find out. The numbers and the stories in this report tell us that managed care Medicaid is failing Iowans with disabilities, it's failing our local providers, and it is failing the taxpayers. In the past year, the Ombudsman's office has seen a 157% increase in cases about the MCOs that are responsible for approving and coordinating the care for Iowa's most vulnerable. The annual report includes select case summaries that provide a small sampling of the complaints that have been filed with their office. Unless your heart is frozen in the ice of indifference, you cannot but be moved by these cases. It is a story of strong-arm tactics that have been used by the managed care organizations against families into accepting reduced services, depriving members of their due process rights to appeal. The MCO's intention to cut services, even though it's a requirement of the federal government to notify people. And of course, payment disputes that have taken more than 18 months to resolve so that our local providers could keep their doors open. But the story that tugged the most at my heartstrings was a man who is a quadriplegic. The MCO cut his service hours by 71% a month, even though the MCO could not cite any evidence that his condition had improved enough to justify this reduction. The cuts were made in the name of saving money, duplication. Here's the irony. This man was removed from his home and his family, and the cost for providing those in-home services was about $3,700 a month. He is now in a nursing home at a minimum cost of $5,550 a month, plus doctor's visits, medications, and supplies. In this report, and I'm going to quote directly from it, the Ombudsman says, "I have yet to be convinced that DHS is providing adequate oversight of the MCOs." She goes on to say, as of this publication, legislation remains alive that, if passed and signed by the governor, would address provider enrollment forms and uniform credentialing standards and provide services when members win appeals. The proposed bill would also require DHS to review and approve a member's reassessment if there is a decrease in the level of service, and to require the DHS to hire an independent auditor to perform an audit of LTSS small dollar claims. Senators Costello, Whitver, Schneider, I'm watching that DHS budget. I am watching it to make sure that the legislation that was cited by the Ombudsman's office to address these numerous problems that we have had more than ample time to address during this legislative session and failed to do so, we have another chance. And that is in that budget bill. Do not be fooled. 157% increase is nothing to be ecstatic about or patting ourselves on the back. This system, like it or not, is collapsing. It is collapsing under greed and arrogance.